Good morning, Sunrisers. I'm Dr. Karen Emerson, and today I have with me Dr. Jansen, and this cute little guy right here is Jax, and he's actually around a year old, and he actually presented for bilateral limping on the hind end. And it turned out that Jax was suffering from a congenital disease called patella luxation. I bet some of you are like, I've never heard of that. I actually have a model to show you the dog knee and actually what the patella looks like. It's basically like our kneecap. And his, instead of staying in the little groove like it was supposed to when he walked, it would just pop out of the groove. So we decided that we started doing patella luxation surgery. And we basically have a criteria we follow here for the candidates we can do surgery on, because a lot of times we do refer these surgeries to an orthopedic surgeon, but we have a technique where we can go in and actually make the groove bigger, and so that the patella will fit in there and not keep popping out. It actually turned out his crest on each side of the patella were barely there, so we had to go in with a bone rasp and basically make a bigger section for his patella to sit in. He's 5 weeks out from surgery. He's actually doing very well. He's walking on it. The patella is nice and stable in there, so it's not moving, because when your patella is constantly moving in and out of your joint, that can make bone-on-bone contact, and that is severely painful. So it was not only setting up arthritis, but he was very painful, holding the leg up, wasn't being as active as he normally was. Now there is some post-op monitoring where his owners had to leash walk him and keep him confined, but he's done fabulous, and we're actually going to schedule his other knee later on to fix that knee also. So if you have a young dog that started limping or just holding a leg up intermittently and then they'll run on it, or crying out in pain, that's probably a sign of some sort of stifle issue like cruciate disease or probably the patella. Give us a call. We can take x-rays, we can do a good exam and see if he's a good candidate for us to do surgery or referral. So remember, if you have a pet having any issues, please call, make that appointment, and I promise your pets will thank you.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.